Nandi County is experiencing a surge in malaria cases. Residents living around areas bordering Kisumu County are particularly affected. The rise in infections comes at a time when the Ministry of Health has stepped up the fight against malaria by embarking on a mass mosquito nets distribution drive in 27 counties. Raquel Muigai reports that not only is the government pegging its hopes on the use of nets and larvicides, but also on the RTSS vaccine.
A sip of water is what Emily Tuwei hopes her 11-year-old daughter's body will manage to absorb. A malaria infection has taken over her body and made her weak and restless.
Mtoto alianza kugonjeka siku ya Jumatatu, lakini baadaye akawa anasikia uchungu ya kichwa. Sema anaumwa na kichwa na alikuwa na joto jingi. Nilipompatia dawa akatabika. Mara ya kwanza alitabika, nilikuwa nafikiria alitabika na rangi ya manjano. Nikafikiria ni pengine dawa ambayo alikuwa amezitumia.
The worsening symptoms forced them to come to Metetei Sub-County Hospital in Tinderet, Nandi County, where she has been admitted since Friday. But she is not the only one.
Mtoto yangu alianza kugonjeka last month. Nikapeleka hospitali wakaniandikia dawa, sina pesa, si kununua zingine.
The last few weeks have been quite busy for this facility, which sits just a few kilometers from the border of Nandi and Kisumu counties. Kisumu is one of the Lake Region counties where malaria cases are rampant.
In May, the total number was 123. In April, it was 93. And in March, it was around 89.
According to Dr. Biwott, the medical superintendent at the hospital, the areas largely affected include Sigoria, Kaminjeiywa, Songhor and Soba River.
The area that border Kisumu County, they're usually warm. It's warm and humid. So this warm and humid provide a good environment for breeding of the Anopheles, the female Anopheles mosquito.
The World Health Organization cites that the long lifespan and strong human biting habit of the African vector species is the main reason why approximately 90% of the world's malaria cases are in Africa. In Kenya, the disease still kills an estimated 20,000 people per year.
During this season, we are alert that there could be upsurges, as we call them, of malaria, because the rains have just ended, and the teams on the ground are working very closely with the malaria program to monitor that.
2 days ago, the Ministry of Health launched the Great Lakes Malaria Initiative Strategic Plan for 2021 to 2025, a boost to the government's collaboration with the Cuban government to spray mosquito larvae at their breeding sites. An exercise that will now see the country make use of drones to spray the larvicide in high-risk areas to between 150 to 180 acres a day. Another important tool the government is relying on to combat malaria is the RTSS vaccine, which has now seen at least 190,000 children under 2 years vaccinated in 8 counties with the highest prevalence of malaria. With the World Health Organization identifying July through September as malaria high peak months, health authorities are calling for a concerted effort in fighting malaria amidst the coronavirus pandemic ravaging the world. Raquel Muigai, Citizen TV.